I gave a couple of presentations. The first presentation I gave at this meeting was focusing on population-based studies in hematology. This was an inaugurational session that ASH had decided to launch. And there were focuses on different types of hematologic disorders, leukemias, lymphomas, and myelomas. As part of the myeloma presentation, I was invited to talk about the devastating World Trade Center terrorist attack that occurred in New York City on 9/11. Clearly a lot of people died immediately when this horrible attack occurred, but what has been also found over time is that this is an unprecedented environmental exposure that occurred in the city. A lot of people that were covered in these toxic fumes and smoke that was produced from the buildings that were collapsing. And this toxic smoke and all the things that came out from the buildings includes, unfortunately, a lot of carcinogens that are known to be carcinogens and other suspected carcinogens, such as asbestosis, PCB, dioxin, and other types of things that are known to be dangerous. For the purpose of multiple myeloma, we don't really know what the risk factors are for the causation of the disease, which is similar to most other cancers. For myeloma specifically, there have been some reports that farmers and also people that work in the fire department may have higher rates of myeloma. And there have been studies looking into what potentially could cause that. After the World Trade Center attack, there was a registry study that was conducted and published in JAMA in 2012. And there were around 25,000 people that participated in this registry, which is called the World Trade Center Registry. And they found, based on a relatively small number of cases, that the increase of myeloma seemed to be about threefold. But it was only based on 7 cases. But if you were to use the population rate, you would only expect maybe 2 cases to occur given the number of people in the study. So that translated into almost a threefold increased risk. There also was a small case series that looked into 8 patients that have been diagnosed with multiple myeloma that happened among people who participated in the rescue work. And what they found was that 4 of those 8 patients were diagnosed below the age of 45. In the general population, myeloma happens in patients usually around the age of 70, and only 3% of patients diagnosed with myeloma typically are below the age of 45. So all these things taken together made us very motivated to consider doing a study. So I worked for several years now with the fire department of New York City and Albert Einstein Medical College in New York City, and my colleagues at Memorial Sloan Kettering, also in New York City. And together we have worked using the World Trade Center Health Study, which is a program that the fire department of the city offers to rescue workers or firefighters that are either active or also used to work and now are retired. So people could participate in that if they were part of the rescue work of the World Trade Center attack. We have characterized all the cases that have occurred with regard to developing multiple myeloma. It's close to 50 patients, and we have characterized all these patients. Also, around 1,000 of these rescue workers have participated in a screening study that I have been leading as a principal investigator together with the fire department and my colleagues at Einstein University in New York. And we have screened for myeloma precursor disease. The final results are not yet ready, but the preliminary results unfortunately show that there is quite an increased risk of precursor disease. And also what we see is that there seems to be evidence of certain subtypes of myeloma that we typically don't see to the same rate as we see. So I think this is the first study focusing in a high-risk exposed large population. So we hope to have these results finalized in the beginning of 2017, and our plan is to continue looking into with deeper methods and assays into the biology of these cases, and also to expand the screening study and the plan is to offer people who were living in lower Manhattan when this attack occurred.